Icons 8 Music.
Hello. Welcome to the next episode in our Sim-portant Conversations at SDState podcast. I am your Master of Cimarrones, Patrick Verley, and we've got quite a wonderful panel here today that's going to talk to us about the SP role and all of the different components of those responsibilities. So I'll begin by having the group introduce themselves.
Hi, everyone. I'm Dr. Alyssa Zweifel. I'm an assistant professor here at SDState, and I serve as the Healthcare Simulation Center Director.
I'm Dianne Smith. I'm a simulation education technician here at South Dakota State.
Hi, I'm Dr. Brittney Meyer. I'm a professor of pharmacy practice for the College of Pharmacy and Allied Health Professions, and I serve as our college's interprofessional education coordinator.
This is Megan Watson. I'm an instructor at the Rapid City campus. I'm also the simulation site coordinator for Rapid City.
Oh, sorry about that. My name's Freda Jackson. I'm a patient here in Prairie View.
All right. Well, thank you all for those introductions, and certainly looking forward to hearing more from each of you. To begin, though, I want to talk to Alyssa about the standards for the SP role.
Sure. Yeah. When we think about standardized patients, we really follow the Association of Standardized Patient Educators, which is also known as ASPE, which is a group that really focuses on sharing advances in SP education, assessment, research, scholarship, really to help guide programs like ours to follow the best practices that are out there. So when we think about the standardized patients, there's 5 domains that we follow within the standards of best practice related to the ASPE. And then we also tap into the healthcare simulation standards of best practices that have been published and updated in September of 2021. So we kind of interlay both of those standards to make sure that we are following the best practices to portray that standardized patient to our students, to help with realism, to help with practicing skills. And the skills that we practice with standardized patients are more interpersonal skills like communication, some of those techniques. If we want to practice a physical skill like starting an IV, then that would be mannequin-based. So we're very choosy on which simulations that we will actually portray a standardized patient in, which falls into those best practices.
Let's transition to talking more about the training then for the SP role. And Dianne, I think you had some things you wanted to share in regard to that.
Yes, I recently took the fundamentals of SP methodology, which is a course that ASPE offers. And then there is a certification exam that goes with that. And I learned a ton about standard simulated patients from taking that course. It's not just going in and someone being a person. There's a lot that goes into that, way more than I had anticipated.
Well, and hearing both Alyssa and you talk about that, Dianne, I think it reminds me once again that I think SIM is a lot more nuanced and sophisticated than a lot of people realize, and certainly more sophisticated than a lot of students understand as well. So I'm curious, how does the team communicate some of these standards to students then?
Yeah, Patrick. So we actually have 2 faculty members that took that certificate program and achieved that this semester, actually. So that's been a huge training curve for us. And then I actually created some just beginning modules that all of our faculty or SPs do when they first come into our sim center. And the first one, it really focuses on just the orientation of the ASPE standards, what they are, reviewing the article that's published, and then understanding just some of the definitions that are out there is the first module. And then the second one really focuses on the SP training piece, how, they study for the script, how they keep it standardized, and then really practicing that role portrayal, which is done with a trained SP educator. And then the third one is really how we give feedback in that debriefing. We have used the ACTS tool for our beginning phase, but as we know from the standards, the debriefing is really important for our students' learning, but it's also important for the standardized patient when they're in that role to also be debriefed on, things that they can change for the next time, and really that psychological piece of coming out of the patient role that they're playing. So we started with those initial modules for everybody, and then our plan is to review that and then add on to that for future needs of our program.
One of the things I think that I picked up, probably the biggest thing from the training and from the certification, is, I don't know, there's more definitions and more definement of terms, I guess, that people, I think, just use interchangeably. One of the things when you talk about definitions, they talk about, when they say SP, they talk about that could be a standardized patient or a simulated patient. And technically, if you wanted to really get into it, those could be two separate things, but a lot of people do use those interchangeably. For our purposes here, we tend to use more of a simulated patient. So the patient is given, a certain script to follow, but if, a student would ask something off base, they, would have the freedom to either say, I don't know, or possibly carry on just a random conversation with the patient or with the student. Whereas a standardized patient is more for the medical professionals, your nurse practitioners, your med students, those kind of things. Those standardized patients need to follow a script exactly for testing purposes so that they know the students come up with the correct result. And I had never thought about that before.
So simulated patient and standardized patient are technically two different things. I think that's good to know. So the next thing that we were going to address in our episode today was have an interview with one of our simulated patients, and that was Miss Freda. Freda, are you still with us?
Oh, goodness, this technology just turns me for a pickle sometimes. I'm here.
Oh, that's great. I'll take that as a yes. Freda's still with us. So, Freda, I want to thank you for joining our podcast episode today. And I was hoping that you could share with us a little bit about what your life looks like right now, and tell us a little bit about your healthcare experience.
Oh, yeah. I just can't wait for all my grandchildren and great-grandchildren to listen to this. Nana is famous. But I grew up close to Prairie View, and I've been going to that clinic for most of my life. My husband, Herbie, we've been married for 66 years, and we both have been going to Dr. Jones in Prairie View since we've been married. I don't know what else you need me to tell you. I guess I really enjoy all those nurses that come in and take care of us, and they really know their stuff.
Well, that's great to hear, Freda. Freda, are you able to have all of your healthcare needs met at Prairie View?
Do you mean that's the only place we go for
Right.
the doctor appointments? Well, no, we actually live 15 miles from Prairie View itself. So any sniffles or sneezes will go to Prairie View. But for the bigger things like my heart condition and Herbie's Alzheimer's, we go to Dakota City. They just have more equipment, and it seems like they're just as helpful, though.
I see. So they have more resources then.
Yeah, they just got a big image thing that they had us go through not too long ago for my bone things.
Freda, I think my favorite simulation where you are a standardized patient is your home visit. When our nurses come in and see you in your home. Do you want to tell them a little bit about that visit?
Oh, yeah. So I've been having this issue with my heart, and the doctor prescribed me this medicine that just makes me go to the bathroom way too much. But these lovely nurses, they actually come out to your house, which is great because Herbie and I, we don't drive anymore, which is good for everyone else, I guess, because Herbert was a crazy driver in the first place. But they come to our house and check us out, which is very nice. And the doctor shows up on these newfangled computer things, and I type in my things in there. And it just seems to work real slick, like, because I don't have to go into the clinics.
All right. Well, Freda, what advice would you have for a future prospective nurse, someone in nursing school right now?
Oh, I think I would just say to not forget to listen to your patients, because we've got a lot to tell you, even if we don't say it with our mouths.
I've heard that that's the most important skill for a nurse to have, is listen to your patient.
Oh, I sure hope so. It seems like some of the best nurses we've had are ones that sit down and chat with us a bit.
We heard from Freda, that she and Herbie go to the clinic at Prairie View and then also to Dakota City. So Prairie View is a small rural community. So they only have a small clinic and a small hospital. And as kind of has happened over the years, basic things are done there. Those places are used as triage. And then, of course, for anything major, they need to head off to Dakota City, which is 2 hours away. So that pulls in our rural component when we work with our students as to what kind of obstacles that may occur when dealing with patients in different capacities, whether it be nursing, pharmacy, all those kind of things, as to where they may not be able to get everything there in one spot.
All right. Well, it was great to hear from one of our SPs right here within the HCSC. And I think that provides some good context for what the expectations of an S are and what that looks like to the end user. So we'll move on then to a couple of our panelists today who are going to talk a little bit about HCSC's collaboration with the theater department. So Alyssa, do you want to start that dialogue?
Sure. Yeah. So the School of Nursing and the School of Pharmacy, we partnered with the theater department this semester to do a pilot study, really looking at the theater students being in that SP role as a course where they use their skills that they learn through costuming, through makeuping, and then of course their acting skills. And then we bring in our simulations where, we want standardized patients and we want to portray that realism. And then they look at the script, we do some role portrayal, and then we've dedicated a educator that does that pre and debriefing to make sure that we're following some of the standards. We had 3 students in our cohort this semester, not as large as we wanted to, but I think we got a great trial. They probably did 6 different nursing simulations, and then they did a simulation over at the pharmacy department where it's an interprofessional with nursing and pharmacy. So we've had a variety of trials for them to do. And overall, so we use the ACTS tool to gauge their performance. And I would say all 3 of our theater students have progressed that ACTS tool. So of course they're meeting some of their needs. And then the realism piece from our students, in the past, we've maybe had faculty play the SP role, or we've switched to a mannequin because we didn't have an SP. And we've had some amazing feedback from students just portraying that realism and being able to get that human connection from those scenarios that we haven't been able to in the past.
Yeah, I would second what Alyssa said regarding the realism. I think it shows why that's best practice to have somebody other than a faculty member in the patient portrayal, because, as students, they know their faculty members, and so they immediately get nervous seeing that faculty member role play a patient, like, oh, they know all the right answers, I'm going to say something wrong, I'm going to mess it up. So I think right away seeing it's an actor who has prepped and is being the patient puts them more at ease, can be more realistic experience, and maybe less nerve-wracking for students. And so I think our theater students have really enjoyed it as well. So theater students require 1 credit a semester at a minimum of activities course, they call it. So a place where they're utilizing their acting skills. So this meets that requirement for them. And by the end of it, they could sit and take that, certificate that Dianne and Alyssa were talking about to become a simulated patient that could be used for hire. So there are big simulation centers, Mayo Clinic, there's one in Sioux Falls that use simulated patients. So they would be able to get a job serving and acting as simulated patients in those areas after this semester of this experience, can put it on their resume. So it's helping them and they're helping us. And so,
yeah. And Brittney, I call this phase 1. Doing this pilot is phase 1. Phase 2, we're hoping to continue with the theater students and grow those numbers. And then in that phase 2, we would also start to hire out appropriate SPs in the community related to our needs for each particular simulation. So phase 1 will be ending here soon, and I'm hopeful that we'll be able to roll out phase 2 over the next year.
Brittney, you mentioned that having the faculty serve as the SP can be intimidating for students, which I'm sure is very true. But I found that, for me, in my experience at least, that's also very intimidating for the faculty that's serving in that SP role, that's also quite anxiety inducing. I'm thinking about a time this summer where I had an experience serving as an SP, and certainly part of the issue was that I have limited experience within simulation, but the script for the sim was asking me to really and make comments about how everything was taking a long time. And I was really reluctant to do that because I was teaching a theory course to these students, and I was worried that the student would be unable to separate that between me serving this SP role and then teaching this theory course as well in real life, right? So I think that the blurring of those lines, I think, is a barrier for both students and the person serving in the SP.
That's a good point. And from having role played a patient as well, somebody who had just gotten diagnosed with a severe illness, and I was supposed to be portraying somebody who is very sad and needing that one-on-one connection to help with my healthcare, and playing that time after time after time. I realized that impact that can have on I just kind of felt down all day because I had to portray that. And then again, that shows the importance of following the standards, to have a moment of debrief after that role play to kind of let those emotions out, reset. You're not this person. You can get back to your normal life and not let your role playing affect you outside of that. So, making students aware they are role playing, this isn't who they are, and the SPs debrief to get out of that character. Experiencing it helps you understand why those standards are in place and what the best practices is, and all for a good reason, right?
Yeah, and Patrick, that's a great example of how people feel when we don't follow the standards. So that would be your experience that you shared with what we want to avoid. But that's why we've implemented this phase one. It's very, very important. The standards talk about that psychological and environmental safety for our participants or students in our case. So we want to avoid putting a faculty member in that SP role because of all those reasons that you just shared, so that students can feel safe in their environment and be able to learn the objectives that are meant for that simulation. So that's just another great reason for us to move to phase two, because with phase one, and only 3 students being in that pilot, we have way more simulations than that. So we need to move to phase two to eliminate any of those potentials of a faculty member being in a simulation when they teach a student.
Yeah, I think that whenever I hear you guys talk about these standards, I always find myself reflecting on my experience as a nursing student. Now, of course, it was a long time ago, but we did have one instructor who was doing the voice of the patient and was the person you'd call when you wanted the doctor, and was, pretty much every other role. And they were right there in the room. There was no barrier between the student and the facilitator. And that was my understanding of simulation. Needless to say, when I came to the College of Nursing, I was really forced to reevaluate what I considered to be quality sim.
Yeah, and that's a good point. So I actually just did a tour the other day with a student that graduated probably 12, 15 years ago. And her portrayal of simulation was very similar to what you just shared. And I said, oh, you should come back and watch simulation now that, we have the healthcare simulation standards of best practice and the ASPE standards, and that just has grown in the last 10 years. Simulation is very different than what the student, saw 12 to 15 years ago. So I'm hopeful that, those students will come back and watch, or maybe potentially be donors to our sim center, just to see that it is very different and the standards have just changed the world of healthcare simulation for the better.
Well, and I think that it helps students then, and I was kind of asking about this earlier, but that communicates to students then that this is a really important thing that they're doing and it's really impactful for their learning. Again, as I think about my time as a student, I remember one of my instructors had given me feedback that they thought I was struggling interacting with the patient, or I was hesitant to talk to the patient. And I remember as a student being kind of defensive about that and thinking, well, of course, it's a pretend patient. Like, I don't feel immersed in this. And of course, I had, as a student, had some ownership for that as well. But one thing that certainly would have supported in me in looking at it as a real life encounter is to do the things that HCSC are doing and following these standards, which I suspect probably didn't exist at the time or looked very different, as you mentioned, Alyssa.
I think the other portion, or the training for SPs, is very important. In fact, like you said, Patrick, were hesitant to engage because you didn't think it was a real patient. If you have a well-trained SP, they will draw that student in when they know the objectives and once they've been trained enough, can kind of pull that student in and get them to engage.
I think the SP process also helps with the suspension of disbelief. So making sure that the patient or the students have that physical component next in front of them and are able to interact with someone that is on the outside is important. We always tell students that simulation is like the treadmill exercise before you run the marathon. So the sooner that you can suspend disbelief, the faster. And I think, or the better your learning outcomes. And I think that the standardized patient program is going to help with that.
And I think having trained SPs that understand their role and not breaking character and staying in character through that entire period, that also helps with that suspension of disbelief. You can't just have your SP wandering around in between sessions, mingling with students and that kind of thing. You keep them separated so that they don't have that opportunity to see them as somebody else. So that's an important piece that goes with that as well. In the training piece, that you keep that person stays in character the entire time.
Yeah, and Dianne, that's a good point to kind of emphasize the important role of an SP educator is to, make sure that we've hired an appropriate SP for the scenario, doing that, training related to the objectives, the role portrayal, really practicing with that SP. And then, like you said, being that person on site for that pre-briefing, coaching and debriefing, all fall into that SP educator role, which is very, very important to be able to run an effective SP program.
I think that, like so many things with regard to simulation, I think there's a lot of misconception, not only from learners, but indeed from nursing faculty as well. Okay, well, I want to thank you all for contributing to the discussion regarding the SP role. I want to wish everyone a great day and a great week on behalf of Sim-portant Conversations at SDState. Take care, everyone.